Right. Sorry. Thank you, Dr. Namrata, for the introduction, and thanks a lot for. It's always a pleasure to be on the AIOS platform, sharing the dais with you. I'll also want to thank Alcon for inviting me over. It's an Alcon sponsored session, and hence I'll be mostly talking about the Alcon specific products, We've had the Alcon platform for a very long time, and they asked me to talk about what's the newest things, what are available, and how it is moving forward. So here I am, and let's start. Right. So the Centurion vision system, or the Phaco machine, has been there for some time, and it was a drastic change in what we used to work with our Infinity systems and the other systems which we had. And suddenly, with the onset of this, there was a paradigm shift to what we could do in our cases, and that's how our journey started with. The active fluidics was something which was very different from the initial Infinity and the Laureate systems. The active fluidic changed the whole scenario and how we work with our Phacos. We then had the balanced energy with these systems, and I'll talk a little about this. The tips and the sleeves, which are the Intrepid platform on the Alcon systems, and my initial evaluation of the newer tips which are there. So my talk is basically on the evaluation of the new tips which are available. So the active fluidics, as we all know, and we've learned about it over the past 6 years now, that the irrigation system of active fluidics, which was first introduced by Alcon, it responds more quickly to the changes in the IOP, and instead of the BSS bag, which in a traditional machine is hanging on a pole, and it's the gravity which drives the fluid in. Here, there are pressure plates which compress and decompress as needed to maintain the surgeon selected targeted IOP. So on the machine, you can actually control how much IOP you want, and if it is a high myop, you'll want to keep it a lot lower so that there's less pain. And besides that, there are a lot of other advantages. In fact, we've gone down to IOPs of 20 as well, which is almost equal to what a normal IOP of the eye is. Basically, why these platforms came on was because of the balanced energy, and the balanced energy was ultimately the torsional Phaco systems changed the whole scene altogether. Now, what is a torsional system is that instead of the longitudinal, which is the traditional system, the tip here does not move to and fro, but it moved from side to side, and hence a Kelman tip or a bent tip was very essential, and this was introduced in 2006. It had a few problems, and this was the intelligent Phaco, or the shots of longitudinal Phaco were incorporated in 2009, and after the intelligent Phaco came in, for the past 11 years, our whole understanding and our whole way what we operate has changed. The balanced energy technology with the balanced tip was introduced in 2013 along with this the Centurion machine, and how we work and the cases we took up for our Phacos were a lot different, and we could take up a lot of other cases which were not amicable to Phaco earlier. Now, there is a great software which balances the energy there. It accommodates the surgeon settings for aspiration and vacuum, as well as the ozil parameters. It increases the cataract material removal efficiency and achieving the procedural balance. So in fact, what this slide is trying to show is that in foot position 2 and foot position 3, you can actually change the vacuum what you set, and these are the parameters what we can actually set up here, and you can actually change them, and that's how versatile the machine is. This is the balance tip which I was going to talk about. So it's a novel tip designed to reduce the stress on the eye. It is maximizing the torsional tip movement and minimizing the tip movement at the incision. So that's the tip, and that if that's in the eye, it rotates at the hub there, and in front it just gives a movement, which is the maximum movement happens here. With the minimal movement there, it's just a torsional movement. So that's what it is called. So the energy dissipated is 31% than the distal maintaining wound integrity. There have been a plethora of studies on this, and the heat production in the longitudinal versus torsional, and after the balanced phacoemulsification tip has come in. So the Kelman tip, which was the earlier tip, had a maximum amplitude of 130 micrometers, which has increased to a 192 with the balanced tip. The new sleeves have helped quite a bit, and these new ultra sleeves do have some finned structure inside where the flow has increased along with the active fluidics. So the way we are working in the eyes and the cases we are taking up has totally changed. So my experience is significantly been better with the thermal profile and better wound integrity. My whole phaco power has come down when using, as compared to the Kelvin tip, about 30%. My surgically induced astigmatism had reduced from 0.34 to 0.25, and the chances of clogging of the tip has especially come down with the balanced tip. It becomes a faster procedure with lesser use of BSS and hence clearer corneas. There is a more stable chamber, what we have seen, and we are able to customize the IOP and use higher vacuum and higher AFR settings. Now, with this shift in the technology, what is the new? Well, the Centurion has been there for the past 7 years now. What's actually new right now is the new interpret hybrid tip. And what is this hybrid tip? It is a rounded polymer edge designed to reduce the risk of capsular tears. So whatever safety we had, we're increasing the safety by providing this silicon, not silicon, but polymer sort of an edge to the tip. The cutting performance is almost equal to a metallic tip. It does. So I've tried it on harder cataracts as well, but nuclear sclerosis grade 3+ is very easily done. The fluidic performance and the configuration is exactly similar to the balance tip, so hence there is no change. So this is the tip here, and we can actually see that they've added this polymer here, which blunts the metallic edge here. So this is one of my first cases which I did perform here. So I'm just trying to show the tip here. It is nothing different from what the tip was, except that the polymer, and you can actually see the metallic tip inside there. And I am going to perform a surgery, and this is one of my first few cases, and I'm performing my direct chop here, and this is in real time, and I am going ahead and chopping the case, and you can see the fallibility is very good. The chamber stability is as it was with the balance tip, and we're very sure about the chamber motility with the Centurion vision system. And as you can see, the fallibility, and it wasn't a very hard case, and we could actually go ahead and just finish off the case. And that's the beauty of this tip, that because of the safety parameters, I could actually remove all of the cortex without even going in with the IA tip. And there's something which was stuck behind. So I'm actually going onto the PC and scraping off the cortical fibers from there. So that's the safety of the tip which I was trying to illustrate, and you just put in the lens thereafter. So that's what I was trying to say, that it becomes a lot safer, and especially in a case like this, which was a case very high myope. So I've done the Rexis, I've done the hydro, I go in with the polymer tip, the new hybrid tip. I'm going to embed and start chopping. So that's the chop which comes in. It's a softer cataract again. I rotate it around, hold it, and start chopping again. So what the problem with the balance tip at times was that in softer cataracts, it used to cheese wire. It used to just go through the cataract. And here, the whole problems which some surgeons used to face with the balance tip just goes away. So you just get it in, and you can check the fallibility. It just comes in very easily, and you're right in the center. And using minimal power, we're able to emulsify this. And this is a bigger chunk which I've taken, as this was a softer cataract, and it's a high myope. And I've kept the IOP as about 22 here. And using minimal power, still being a high myope, we vary about the fluctuations, but the active fluidics work very well here. And I'm able to remove the cortex here. And you can see there's no, the stability of the anterior chamber. Again, in this high myope, I'm just scraping off the fibers from the PC. These are some fibers there, which I'm just going to scrape off, and I've put the lens in thereafter. This is a hypermetrope, and I've just done the hydro here, and I am going ahead and trying to do a sculpt. I've sculpted it a little bit. Going ahead, chopping it into smaller pieces. This was a shallow AC. I did use a little bit of viscoat here. And as we can see, I'm able to remove there is no compromise in what we had with our Centurion machine by using this hybrid tip. And it's going to change the whole game altogether, because I've just used it in 3 of my OTs, but I have in quite a few of my cases not used the IA at all. And I've just been able to finish off the whole case without introducing the IA. Basically, I was trying to demonstrate that the safety of the tip and the chamber maintenance, as well as the PC which stays back all the time. So here we go again, and here you can see that I'm going, in fact, behind the iris as well to pick up the cortex. That's the cortex which is being pulled out, and I'm not using a IA tip here. I think in this case I had to, but this being a high myope, I'm using one of the expand series of the Alcon lenses here. Now this is a small pupil with sticky cortex, and as you can see, it was very small. So here we're going to embed it, and it was slightly on the harder side, and it's one of the diabetic cataracts which is slightly sticky. So that's my initial chop, which I've done here, and that's the second chop. I have to do a multi-level chop here because it's a sticky diabetic cataract. So this is the multi-level chop what I'm doing, and as it's a small pupil, so here I was just trying to show that I have actually caught hold of the iris also. So I'll just try to go back slightly, and let's see here as I am going ahead, I am chopping here. And if you see here, I have, that's the next chop here. And if you see here, while doing this maneuver, so that's the chop which is coming through. I'm now removing this cortex, and I just wanted to show that I've actually held the iris edge there, and in spite of holding the iris edge, it's such a great tip that the pupil hasn't come down. There's no iris dispersion, and I've been able to manage this case without the use of any rings or hooks, in spite of my doing the maneuver where I actually held the iris. I'll go on to another case here. Sorry, this is my last case here, which I want to show. I'm going in using the same tip. That's my initial chop. Gone in, the chop going through and through. Chopping it at various levels. This is the cortical cataract, which is slightly soft. Just rotating it around. And the efficacy is as good as a balanced tip. I've just forwarded it a bit. And now, as you can see, I'm going in and I'm just going to remove all the cortex with this. I have actually held the PC a couple of times with this tip as well, inadvertently, and there was no PC tear. And in the last case, as I was trying to show, that I actually inadvertently also caught hold of the iris without any issues. So it's a great tip, and it increases the safety of the whole, and the whole ball game changes because the safety parameters have changed altogether. So I found that it cuts very well and does not have any negative effect on my efficacy. It is much less likely to break or damage the capsular bag, the PC, which any other metal tip which have a slight burr or scratch would do. And this cannot happen with the hybrid tip. So that's what I would say, that it's increased the whole ball game. It's soft and kind to whatever tissue it engages. The hybrid tip can remove segments of the nucleus and make grooves or divide and conquer as well. And I've done it for grade 3 as well as a grade 3, almost +4 cataracts. I have not evaluated in very hard cataracts, but I have done it in an intumescent cataract as well. And the efficacy, there is no compromise on the efficacy. The only case where you may lose some efficacy is low vacuum sculpting, if you want to do that in mature or brunescent cataracts, but it still can perform well once the cataract is fragmented. So it's the subtle edge in handling very soft grade cataracts, that's how it helps you out. And that's what my advantage is, that whatever problems I used to face with this softer cataracts, with the balance tip, I don't face them anymore. It can help make it work near the capsule for removing the epinucleus, and that's what I try to show in all my videos. And it can be a justification to be able to perform in the bag implant, in the bag phacoemulsification, to cut down this the cumulative dissipated energy and the fluidics, the BSS consumption, leading to clearer corneas. Thank you. Thank you.